There's a new area of healthcare that's starting to open up on the African continent. And while Africa has the world's youngest population, there is a need to pay attention to the growing population of aging Africans. It might surprise many people to know that by 2050, the older African population is projected to total 235 million, surpassing that of Latin America and Northern America and approximating that of Europe. Africa's population is aging just like the rest of the world, but the continent's governments are badly equipped to handle the growing number of older people. By 2050, the elderly will be about 10% of the continent's total population. And in some countries, the proportion of older people will almost match that of industrialized countries by 2030 and 2050. In some African countries, the future has already arrived with percentages of elderly people much higher than the continental average. The proportion of over 65s in Tunisia is 7.3%, and in Mauritius it is 6.9%. The elderly population in those two countries has nearly doubled in the last 20 years, and other countries such as Botswana, South Africa, and Libya have followed a similar pattern. My guest today is Abiola Osibanjo. She's CEO and Nursing Director of Bethcare, Homehealth, and Nursing Agency. Abiola, welcome to Business Edge. Let's talk about your healthcare services business. So one of the things your businesses does is provide home health care to the elderly in Nigeria. So tell us, how did you get started?
Hi, Tolu. Thanks for having me. Bethcare started in 2019. I had relocated back from the United States in 2017. And having worked in acute care in a hospital here in Lagos, I realized that there was a lack of aftercare when we discharge patients. When you're discharging patients and you're explaining to them and they look like they don't know what they're talking about. And when they get home, what are they going to do? So I realized that there was a bridge between when patients leave the hospital and when they get to the house. And I decided to come up with Bethcare just to bridge that gap and provide services at home for people that would need it after leaving the hospital. Mostly, that was why we started Bethcare.
So it's very likely when you started this business, you're probably one of a few who were involved in the business. How many, in the years that you've started the business since, how many more such businesses have you seen come up in your industry?
So when we started Bethcare, we did a market research to see how much of this is in Nigeria. It's very few. It was very few then, and they do mostly caregivers. They just put people in your houses. We took it up a notch by doing the whole holistic care, which is, doctors, nurses, caregivers, physical therapy, and also some form of case management, because we find out that when patients are leaving the hospital or they live in an acute setting, they have no idea, are they going to need a hospital bed? Are they going to need specialized equipment? So we've added that on, which is something that most of the companies that are doing home care right now don't have. Over the years, a couple have sprung up, and most of them are being pioneered by healthcare workers. And most of them are also people that have relocated from diaspora. So it's coming up. It's a new market, and we're having to convince people that we are worth whatever we say we want to do and whatever we want to charge. So over the years, it's been coming up more.
Okay, so let's look at the sort of the elder care part of the business. And for many of us as Africans, we typically will say we'll take care of the elderly relative in our home, or whether it's a friend or family, loved one, as it may be. And it might shock many people that there are more and more people who are sort of outsourcing this healthcare service. They're outsourcing this need. The typical response would be, I can take care of my elderly mother, father, aunt, or even a disabled relative by myself at home. But that's not always the case. Why is it better for us to start looking at more professional help? Why is it necessary for us to realize it's not that easy?
Yeah. So over the years, that question looked like a twofold question. Over the years, I realized that Nigerians have always had some kind of maid service at home. So even if maybe your father or your mother fell down or they went to the hospital, we automatically have the maid that is already in the house just take care of them. And what we realize is the maid has no clue what they're doing. They have no idea what medication. They will just tell you, I gave them a blue pill and a green pill, and that's it. So there's no continuum of care, and there's no escalation when there needs to be. And when people say they can take care of their family members, now the world is getting busier. The world is getting, I think, the Generation X or the generation that is taking care of the elderly are all leaving the country. So we are forced to outsource a lot of things. We cannot do all these things by ourselves because we're busy. There's so many factors into getting, the care that you want to give your elderly one or your family member that is at home when you're gone out of the house 18 hours out of 24. So it's really becoming more apparent that outsourcing healthcare to the right person, to the right personnel, the right amount of degree and qualifications is becoming more and more apparent as the years go by, and especially with a lot of our clients that are in diaspora, because 80% of our clients right now are not in the country. So their children are outsourcing their healthcare needs to people that can actually be held accountable, knowing what they're doing and when to escalate things if need might be.
Okay, so I know you also have done some work in the U.S. in terms of the healthcare service industry in the U.S. as well. And as you said, that's part of the reason you set up this. You saw the need and the gap here in Nigeria. But we also like to talk about the fact that we are seeing an aging African population. You've made mention of the fact that some of these children will be outside of the country when their parents and elderly relatives have needs. When it looks to how we prepare for an aging Africa or an aging Nigeria, what do you think governments need to start planning for? We can talk about Social Security in the U.S. We can talk about healthcare services and elderly living communities where, quote unquote, old people's home, where old people and older people can go and they find a community of like people. But we don't yet have those kind of things here. So what do we need to start preparing for as we see a greater population of the African population age?
I think going forward, when we talk about government and healthcare, I don't even know how to even merge that. We have realized in Nigeria that healthcare has become so personalized and so privatized that the gap between what the elderly need and what they're getting right now is so wide. There is no provision. You are finding people that don't take their medication because they cannot personally afford it, or their children have been overextended by paying for XYZ healthcare and all that stuff. That some things fall through the gap, and I think a lot more people need to understand that things need to be set in place for the elderly adults. I work with the Coalition of the Elderly People, which is a new organization that just started in Nigeria, where we actually are putting the elderly into the budget and trying to get them into legislation that money needs to be set aside for elderly people, because even if it's just to give them relief from medicine or relief from feeding, because as bad as the economy is for people that are working, you can imagine how bad it is for people that don't work, and some people don't have pensions, or people have pensions and they haven't been paid. So where the world is going now is more personalized healthcare, where we ourselves have to take matters into our own hands. Can we set up stuff in our community to help elderly, stuff that like day to day will help the elderly in our community? Because honestly, I don't even know. There is a huge gap, and we are really trying to fill it, but it's not that it's not that conducive in Nigeria.
So I think my final question will also be a follow-up question to that, because it's about the trends. As I said earlier, we can see the numbers coming at Africa in the next few years, that the older African population will get to about 235 million by 2050. So while we say we're the youngest continent, we also have to realize we do have an aging population that's going to put pressure and demand on healthcare services, on the government, on so many other aspects of things. So Beth, so Abiola, what do you think are some of the trends we should take notice of when it comes to healthcare as it changes to meet the needs of our evolving populations?
Okay, so when I look at trends, like you said, I flip back between the United States and here, and the trend in the United States now is especially since COVID, is telemedicine, telehealth, more artificial intelligence, acute care that is more, directed towards one-on-one care, virtual acute care. So I think with Nigerians, I think one of the things I think we need to be cognizant of is personalized care. So follow up with your doctors, second opinions, get doctors that can do telehealth, that you can get involved. So if you have your parents in Nigeria and they're here, there's no reason why you cannot get on a WhatsApp call and talk about what they need, what the requirements are, and try and put those things into place. Because even if in the grand scheme of things we don't have things that the other developed countries have, we have a lot of resources that we can use personally to make sure that our elderly population are not falling through the cracks. I hope that answered your question. I don't know.
Yes, it does. It does answer my question. And I'll finally ask, you did bring up COVID. So how did COVID-19 rather, that is, impact your business? What did it do? Did it also force you into this innovative, more digital space with your business operations?
Yes, it did. So COVID was a catch-22 because initially we didn't know where we were going. Fortunately, I was actually, I don't want to say stuck because I made a conscious decision to stay in Nigeria during COVID. So at the beginning of COVID, we didn't know where it was going. But then we realized that our elderly people were getting ill and we were getting more acute care done at home. So we were able to successfully set up a mini ICU in most patients' houses. We had patients that already were in the house, elderly that had COVID, that we would not take to the hospital, that we managed them at home, with oxygen, we had suctioning machines and all that stuff. So it increased the level of things that we actually could do at home with the right personnel. So COVID was kind of good, and for us to understand that the way we practice medicine at home can actually be, it broadened our horizon with practicing medicine at home. So we were able to do more than we thought we could do before COVID started.
And I hope that more has continued as your business expands. Abiola, thank you so much for joining me today. We'll be talking to you soon.
You're very welcome.
All right.